And I might breathe over that shoulder, so if you want to, yeah. Right. Feeling good, Dave? Good. So just, it's good to harmonize your breath with the other person too. That's one way of building the bridge of trust and empathy. It's also like if I breathe deeply, it's going to encourage him to breathe deeply on a subconscious level, like a person, yawning in a room, other people yawn. So even if you know, it seems weird, but like even if you burp or something like that, it's allowing that person to go, okay, I can burp, you know, or whatever. So I'll just, you know, not at them, but over your shoulder, whatever's going to come out naturally. So this is a very, very important point in my opinion. So we've got this tension that's coming through here, affecting his, you know, this jaw up here. It's coming down. It's coming down from the thumb, okay? Like we've got both the inner and the outer thumb bands coming through here. That feels really tight. You know, so the whole thing, I want to release this thumb. You know, it feels quite tight. This spot here, automatically I know I can feel it's charged in there. But I'm going to start here. And I'm going to start by going right to this point. And this is where you've got the inner thumb bands, you've got the outer thumb bands here, all joining, right? And tension coming in from this part of the thumb. So even this band that comes through here, it probably goes underneath the nail and then comes out here. Okay, of course we don't, you know, where we start on this band is a few millimeters below the nail bed, because otherwise you're getting into the nail bed and causing bad pain. So again, I'm going to just start to, and I'm really watching. I'm not going in fast and in a jabbing manner. That's where people make a mistake here. I want, again, what did Dave say? A 9, you know, is fine, right? He knows what it is. So I'm going, okay, I'm feeling like, but I could ask him, hey Dave, out of 10, how's that? 8 or 9? Yeah. So I increase just maybe 5%, and then just watch his breath. Because he's the one that's going to shift this through his breath. I'm going to bring awareness to the energetic blockage, and he's going to shift it. And what I'm doing is just bringing awareness. So you can see I'm just holding that spot. Right? And he's breathing it. And I'm letting him breathe. I'm not trying to force it. Patience and perseverance are two very important qualities in a massage therapist, okay? People who are impatient tend to then go too hard because they also think it's all about them. It's not all about me. It's all about his breath. I'm a servant of his breath.
I worry I'm taking too much time and it's going to cost them too much money. So I think I need to change my pricing plans to like, for when I do this, it's just a price. That's
often just in your head too, because if you're working them at a 9, they're not going, oh, go harder, or 10, you know, oh, work me till it's overwhelming. They're not thinking, they're thinking, fuck, this is intense, but I can just handle it, you know. So just, you know, like I say, it's just conceptions that people have of massage and all this kind of nonsense. You know, we got to get out of that. Okay, there's a lot of bullshit, you know, what I call bullshit for general, you know, as a general word.
Well, people still giggle when I say I do massage.
Yeah, that's right.
And you're just like, really?
Yeah. Give me a big toe, let me stick a chopstick in it. See how it
goes.
I might have a good giggle.
Yeah.
Because you're an asshole.
That makes me about this.
Right. Well, let me focus on Dave rather than assholes. Yeah.
Do you recommend people do some sort of like inner work? So I noticed that some people are happy to release, some people still resistant to release in the clinic.
Yeah.
So I started like a little well-being challenge for the next 30 days I can join for free to do something for their head, heart and soul. So do they need to do like journaling and things to help them let go, or boxing, punching a punch?
Anything like that's going to be beneficial. Like if they got anger, go out. You know, when I was doing a lot of my anger releasing early on, I'm going to give Dave a break from the chopstick. Okay. Just do a bit more of this. I did a lot of primal screaming therapy, you know, like just breathing in and screaming, or going out into the waves like as I was in Australia, and punch waves. And
I do tell people that, like, go to the river or the sea,
where you
really big rock, and just show into the sea and shout fuck really loudly.
Yeah.
Like sort of
swearing really helps. I find, because it,
Or at the top of a
I always
mountain.
swear when I'm stressed.
Yeah.
Yeah.
Always.
well, it's a different part of your brain, because some people can get brain damage and all they can do is swear. They can't actually talk. You know, certain forms of Tourette's and things, right?
Yeah.
Right? So it's a different part of your brain. It's not,
I think we're not
it's an
allowed
emotional
to be
language.
Angry, are we? We're not allowed to be angry.
That's what
so
I'm
we
saying.
store it. And I
That's
think
right.
women might do it a bit more
That's right.
because
It's women shouldn't be angry, men shouldn't cry. So, you know,
Especially British too.
yeah.
British has got a lot. It's a lot of like how
when
you
just
should be
live
like
with a shit of
Japanese.
passive aggression on
That's
daily
right.
basis,
A lot of
which is
women are
a little
passive
healthy,
aggressive,
a
you
little
know?
healthier, isn't it?
Oh
I
yeah,
spend a lot of my week telling my mum not to be so judgmental.
yeah. No, I know. I had to detox from a lot of my mom's stuff.
I
It
love
was
her
so-
dearly, but the
I know.
elder generation, geez.
Oh yeah, no, I know. It's so such full of shit. You
It
know what I
is,
mean?
isn't
My
it?
mom was always trying to be like the queen
I
or
love her
something.
dearly,
And
but no, we don't need to chat
Dave,
about
is your
it.
sense of the numbers changing as he holds the pressure there?
So we were kind of hitting 9s, maybe a 10 with the chopstick, and it's kind of dropped down now to.
so this is, I'm giving Dave a rest because I knew I was hitting some spots, and you know there was a slight, you know, obviously I'm talking with you guys as well, so I'm not quite as present with him. I'm still trying to be present, but I'm not as. But I'm giving him a little rest and using the wider diameter because it's not as intense, just to sort of shift things because I know that was really hitting right up there. Okay,
Reminds
so.
me of it when electricians pen, you know, when they're trying to find whether there's a current or not. We're probably doing the same thing. We're looking for energy, aren't we? So it's
Yeah.
the same.
Mhm.
Posh electricians, human electricians. Maybe that's what you call our
So you can see even when I come back to that spot, even with the broader tool, you can see that slight flinch, right? That slight flinch is an indication that you're close to a 10 or out of 10.
What is that tool, Brandon? It's not a massage tool specifically, is it?
Yes, it is.
It is, okay.
Mhm. Yeah, I'll have to get the name. My wife got it for me as a present to try out.
What do you put an
Are you
acupressure?
acupuncture pen on Amazon?
All
I've
right.
got two. They're about £10. Roughly, one was 12 and one was 7. I think that one was 12.
I find being metal, it's a little bit easier when you're moving. With the wooden chopstick, I tend to hold a spot and move it and hold a spot. But this one, you can slide a little bit. Maybe not with really dry skin, okay? So that, but it's better for this. How does this feel, Dave?
Great.
Good. So then I can hold, but I can still hold a spot and then move it against there. And as I say, I spend 70 to 80% of my time now between here and here. After I've done the head and the belly. But because if I do this well, this will all just go. It'll be so easy. And if I don't, it won't go. And I could do bad pain, where bad pain to me is where you're working against somewhere, say higher up, but it's anchored here. So if I just rub in here, or if I rub in here, Dave will know right away, this is just hurting. It's not helping because I haven't got
It's
the
not
roots of it.
released,
It's
yeah.
not released. So, you know, we don't,
Find, yeah, when I've got one person I've been practicing with the tools on, as well as myself, which is my mum. But yeah, and it gets trapped in the knuckle. I can take it so far, and then I find it traps. Especially when I practiced on myself, on my little finger, the energy was painful, and I couldn't get it out, no matter how much I shaped and massaged my finger.
were you deep breathing at the same time?
I think because I wasn't.
That's the problem with
Makes sense,
working on
because I was
yourself.
doing myself.
Yeah, yeah.
Yeah, that.
So
there,
that's the
yeah.
problem with working on yourself is you focus on what you're doing, but
Yeah,
you
it's
need to
still in
deep breathe.
there, like I can feel it, but yeah, it's because I didn't breathe.
Yeah.
Yeah, you're right.
You need an educated client, though, Brandon, right? To allow you to spend so much time on a point like this.
That's right. That's what we call, yeah, educated and green light. And who's going to do the educating to get that person there? It's often you. It may not be. They may come from like my videos, my YouTube channel, and I might refer them to you, and then they're totally. And if you don't do this, they'll be upset. You know. Like yeah. What's it? Yeah. I like an exorcism with a lot of detail. Yeah. Like, can you do that, please? Brandon does it. You know.
I've got a little piece living in the brain, Dave. Yeah.
So I'm doing my best with YouTube to educate them. But okay, so again, let's focus on Dave.
So we could see that you could slide with the metal one, and that you find this.
This one I tend to keep, so just like we can like roll over a muscle while I'm still on the same spot, right? I'm not moving on the skin, okay? The same with a chopstick, and that's why I don't like to have oily fingers or use oil when I'm using tools, okay? especially here, because we want to, it's an energetic spot. As we come, and even here, we don't want to be wildly going around. So what I'm doing here is I'm on the band that's tight, the energetic band and the physical, and I'm moving the skin over the band. And that's, the diameter of the band is literally like 2 millimeters here. It's even less here. Okay, and if it's not releasing, I need to come back here, okay? And just do a little bit more work here. And because it's so intense for him, again, I just want to figure out, we're hitting, you can see as he flinches a little bit, we know we're up there, right? And again, I just want to hold it.
I was going to ask, contraindications, people with fibromyalgia or Raynaud's, could you...
You do it gently.
Do it gently.
Again, up to what they can handle. They, oftentimes the fibromyalgia, they can't handle very much.
Yeah, but they might be able to handle more here because it's quite strong
Yeah.
than what you could here.
Oh yeah, well that's why I wouldn't do it there. Yeah, that's right. But again, everybody's an individual, so, you know, I never like to treat a disease as such. I like to find and get rid of energetic blockages, you know? And with all those kinds of, I had one of my ex-teachers actually, she was working on a woman or a guy with fibromyalgia for quite a few years, and it helped him enormously. Didn't cure the fibromyalgia.
Really, really ill. The doctors haven't been able to diagnose what it is, but he's very poorly. Yeah. I was waiting to come here. Like I've held off having him last week to learn more so I can hopefully help him in a better way.
So I'm just going to focus here on Dave for a little while, and then we can take some more questions. But I think it's very important here in particular to keep the rhythm going and my connection, because you can see how tight that is right there, right? See how I'm flicking over that? That's very tight in there. And that's coming from here. That's going to add to this, which is then going to add to this. So again, I'm coming back to this point, but it's so sensitive on him. I want to keep just giving him a little bit at a time. Otherwise, it's going to be too overwhelming for him. And he's just going to feel like, oh, fuck, I need a break from that spot. So I'm going to move this way a little bit. So I'm giving him a bit of a variety around the different micro bands, but they're all tight. But really just focusing in and trying to tune into his breath and this spot. So I sometimes like to just go within myself, because you're not feeling it physically here. You need to feel it energetically. So I sometimes will close my eyes and then just the slightest movement, and you can see that slight movement is quite a big, it's strong for him, right? So how I see what's going on here is not necessarily with my eyes, although like I can see this, but I can't see how tight it is. I need to go in, close my eyes, and focus. And then slight movements. So I activate the spot, and then I slightly move it. And you can see that's a very powerful. But one thing I really want to emphasize about this kind of work is not to just go through the motions. Okay, many people when they first start to learn this, oh, I did that, you know? But if you're not sensing what you're doing, you probably didn't do it properly, okay? So it's very important, because it's not just about the physical tension, because you can't feel it as physical tension in here. It's an energetic blockage, which is underlying all physical tension, actually. But here, that's all you feel, until you come to around here, in which case then you feel it as a physical band. And so when you're learning about whether what you're doing is effective or not, if you're not very energetically tuned in, you can come to this spot and feel the physical aspect of that tension. And I can feel how it's very tight on Dave, okay? Which is what we were suspecting, right? With all that jaw tension and everything. So my main thing is to work if I want to be as effective as I can in the amount of time I can, I'm working him at 9s. And that means me tuning into him, micro and macro. So tuning into the point, but also his breath. So I can increase that pressure slightly if I feel like he's not, to give him value for money, which is what you were talking about.
Yeah.
Then, Well, if he's not
go to the
if he's not
their
breathing
highest.
deeply, then what he's saying is that I can handle a little bit more,
Yeah.
right? And then I see he's saying to me, "Thank you, Brandon. That's near what I can handle," you know, in that polite Scottish manner, you know. And I can speak polite Scottish, you know. My accent's not that great, but I try, you know. Can you feel that, Dave? Is it a wee bit sore? Right? And that's about as good as my Scottish accent gets. So, but you know, mostly it's just you're just talking without talking. Okay, I'm just watching him, and I should be able to go. That's. And each time he's actually just going to get more relaxed because even though, yeah, this isn't, having a,
See,
he's
I
getting
the
into it.
mindfulness of this and
The-
the fact you're in the moment
Right.
and you're on it.
Yeah.
But then I worry for the person on the table if they're not understanding Raynor properly and the fact that I'm spending so long on the arm.
Well, explain it to him
But that's
before you do it.
It's all that, isn't it? It's the whole session of explaining absolutely
But that
everything.
diagnosis, isn't it? Is that
Yep.
first consultation?
First consultation, hi, how are you going? Nice to meet you.
Yeah. So I
Okay?
think I'm going to be going back to my
Right.
clients.
Yeah.
Like you're saying, giving them the introductory rate again for one more session to do a proper diagnosis.
Yeah.
And
That's
go,
a good idea.
So in a sense, this isn't the first treatment because I've treated Dave before, right? And
Yeah.
Dave understands, you know? So I don't need to go through, which is kind of nice for
Yeah,
me.
I've got people I reckon I can, definitely will be up for it.
And once they understand, then great. You don't need to keep
Yeah,
it.
exactly.
Don't over-explain when people already understand
Okay.
because you're wasting time.
Yeah.
Again, maximize, especially if you're wanting to charge what we call top dollar, which I guess you'd call top pound. I don't know what the expression is.
Yeah, top whack.
What is it? Top Reich?
Whack.
Top whack. Whack. Okay. If you're wanting to charge top whack, then make it that the person feels that they're getting incredible value for money. Okay? Because I remember even years ago, one example I'll give of is when I got this massage from the guy. He was pretty good at it, but then he started talking about the drum in the corner of the room of mine and how his drum was like that.
Oh, yeah.
And his complete awareness left what he was doing. And all I was thinking of for the 10 or 15 minutes he was talking about my drum is I couldn't give a fucking shit.
I've been to
And I'm
someone-
paying you a lot of
yeah.
money for your time.
Yeah. I've been to someone who's answered a text.
Yeah, how rude, right?
I know, right?
Yeah.
I didn't go back.
Right. So I actually don't think getting involved, like if I'm just working on Dave without you guys, I wouldn't be chatting to him right now. I could, hopefully we've done our chat if we've caught up, but while he's doing this, I want him totally focused
Yeah.
on his breathing.
Brandon, when you did his head, it seemed
Yep.
to me that there was you felt more tension on the left side of his body. Is that why you're working the right side first, or is that just arbitrary?
No, I felt tension on both sides.
Right,
In
so-
fact, slightly more on his right. Plus Dave felt more on his right.
Yeah.
And he specifically asked me to, and he's right-handed.
Okay.
You're right-handed, aren't you, Dave? Yeah. And he's a massage therapist, so I can totally
So just
identify
went
with,
straight
with, with the messed up thumb on the right side because
So
I've had
you've
it.
heard in shiatsu, if you can release from both sides of the body, and sometimes you might start with a side that has less tension before
Yes.
you go into it.
Where I would start with a side of less tension is somebody who's really not got much of a pain threshold at all. And it's just, you work on the tight side, and as soon as you work on it, you're hitting their threshold.
Right.
And it's just kind of useless because you can't get anything done.
Yeah.
Whereas if you work on somewhere that's not so tight, you can get something done. So now I'm just gently working the side to side movement on this joint just to open it up a bit. And you can see he's enjoying that, but I'm easing it off. I don't want it to be too overwhelming,
How far do you actually wiggle it, so to speak?
As much as it'll go, just taking it,
before you break it.
Yeah.
Yeah.
Yeah, it depends on the person and how much. See, now I pulled it and it clicked, right? So that's going to open it up a bit more. Now I'm going to come in and do this one. Again, this is one of the most sensitive spots on the body, so be very careful.
Is that the side of the finger?
I was going to ask, did you learn some of these techniques from
There.
Gestapo?
Oh, there.
Sorry?
Did you learn some of these techniques from Gestapo?
Yeah, past life, yeah. They were very effective, yeah. So again, you can see if you see how much pressure I'm using, I'm mostly keeping the weight of the chopstick maybe 2 or 3 times the weight of the chopstick there. It's so sensitive. And then I'm wiggling it slightly and watching his breath. And then as he gets used to it, I'm going in a bit deeper, and you can see immediately I'm back up at a 9. And then moving that. And letting him catch his breath, okay? Because this has been quite intense. So I can see he has a couple of breaths worth just to catch up on. And this is where, again, I'm not doing anything, so yeah. But it won't work if you have too much of a backlog, right? So then I can come back in. And as you go higher, you end up doing more big range of side-to-side movements, okay? So then again, I'm going to start to feel that thumb, that joint, any trapped energy, and I might come in with my fingers and thumb. And you can see it's not just the chopstick, it's the fact that he's super tight in here. That's what's causing that. And then I'm going to just... Got a deep click in there.
About that.
Yeah?
Yeah.
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 I love it.
Yeah.
No, don't screw me.
Sometimes I've got to stop myself and go, yes!
Yeah. So I'm starting to feel like I'm making some good progress all over his thumb, like 20-30%, you know? Not huge, and I know how charged he is here because I could feel it here. So I'm going to go into that spot and just hold that and move it slightly.
Yeah.
I'm picking up energy in my hand, so flicking it off and then just working it up slightly through here. Because this is obviously very tight, you know? And coming into here, it's very tight. So if I've got 20-30% out of here, I should be able to get then 20-30% out further down. Now finally I'm going to come into this spot, and I know it's sensitive and tight, so I'm just going to do it with a bit of awareness and watch his reaction. You can see there, so not too hard, and just hold that a little bit like that, and then let him breathe, and then just add another 5%, and you can see that's, you know, enough. So you can see his eyes start to...
Mine a lot, I've done mine.
Okay, and then gently shaking it. So we're moving, holding, shaking, getting rid of, opening it up. So this is how I open up that thumb, is just to, and then I can twist it slightly and come right down into here. So right where the thumb and the finger join, that's the most powerful part. I actually think there's more than one pressure point in here, okay? Even though in
You can
Chinese...
lots of different tight spaces
That's right.
in there, I find.
Yeah.
Yeah.
Very important area. And it's a great area to get people to deep breathe, because in Chinese medicine, this is a lung meridian.
Are you using both thumb and finger pressure?
That's
there?
right. Otherwise, you're just pushing against it, it does nothing. You have to do thumb and finger, okay? And then you go. And then watch, and then hold and shake, and let him breathe out. Okay? Again, just gently stretching, rotating. Okay, so we're made, you know, it's not loose, but we've made some progress. So I'm going to follow that up and get whatever I got out of his thumb, up both the inner and the outer thumb band. So again, just holding and moving.
And the pressure's coming from both sides?
Yep.
Your finger as well as your thumb?
Mm-hmm. And not too heavy a pressure from my point of view, but it's, because it's so tight, it's probably going to be, you know, it's sore.
You're feeling up the band there, I guess. Right?
Yeah. Mm-hmm. And then I can hold, and you can see when he opens his mouth like that, you know. That's Scottish for you. Thank you. You found the spots, Brandon. So what I'm going to do is come in a bit more, like open it up and do it slower and not quite as deep, and just let. But you can see it's not even. It's so tight in there. And let him breathe. I don't want him tightening up against me. So I ease that pressure off to a point where he can handle that. How's that, Dave?
It's a 6.
6? Okay. And I want to feel, is it letting go or is it still anchored? Okay? Or maybe it's partially letting go and partially still anchored because I've only got, 30% out of his thumb. So I'm not expecting 100% to let go, but I'm expecting some percent to let go up here, which will then provide some relief up here and provide relief into his neck. But we can see how he's very tight in there, but that's, more the inner wristband. But I haven't done those fingers, so.
Would you go back down if it's not releasing up there?
Yeah. Or I might get, keep the 30% if his thumb's too sore, or too sensitive to work on, and then I might try and get more out of his fingers, because this is so tight here, right? Which is more from the other fingers, the middle ones. And again, just getting in there and seeing what we can get out. Because I feel like this whole really needs a bit of work, So I'm going to come back and I'll probably get that joint after I get this finger, okay? So I just come in gently and you hear those clicks? Yeah. All right, so supporting that joint and moving it side to side. I can even do all of his fingers while I'm at it. And I can diagnose from here. This is a great area to diagnose from. So if I'm getting a very limited range of motion, which is fairly limited, it's not extremely limited, but it's fairly limited in here, I know that finger's tight. Now I can also have a feel of this one. And again, we're not getting a huge range of motion here, okay? Great diagnostic area. Okay.
So if there's not much motion in the tops of the fingers, that's the band
Yeah,
really
yeah.
follow.
And so it's both of these fingers that are the worst. This one's, because, this one's actually pretty, it's okay, Like you can see how, you can feel that joint, it's got
I find a lot of stiff fingers.
Yeah. And but this one, it feels, even this joint doesn't have a great range of motion, right? Whereas this joint's a bit better, but then this one's not good. And I often find that. So I might even, I don't have to come in and do this finger next, even though it does need it, but this one and this one need it more. So I might start here.
So how do you know that?
By the joints.
Okay.
Limited range. See the limited range of motion that I'm able to get out of that joint? You watch after I do the tip of the finger and the sides.
Okay.
That'll increase rapidly. Okay, so pay attention. That's how much I can move it.
Yeah.
Okay, right now. Very limited range of motion, yeah?
Yeah.
You want to see that? Yeah. Okay. Now we'll see what happens when I do this. Again, I can get Dave to breathe, but it's not a fast, never use a fast jabbing motion. Sensitive, gentle, going in and sensing. Like it feels automatically, I can feel how charged it is, so I know that's going to quickly hit his threshold. I can ask him, Dave, how's that out of 10? 9? Okay, so I don't want to go much harder. I just want to hold it there and let him breathe into it. Sometimes I feel energy come into my arms, I can shake that off, come back. And you can see how easy it is to hit his threshold here. It's not a heavy pressure, but because it's so tight, and it's not because of his pain threshold, it's because he's so tight. Anybody who gets this tight will have, it'll be sensitive, okay? And as we loosen it, it'll be less sensitive. Simple. So again, I just let him breathe. I change my angle. So changing the angle, even though it looks so slight, it's very different sensation, okay? So I'm finding where the chart, it's like I don't know, like a laser beam is the best way, but the slight change is and again, I can feel it because my hand over here is up here. It's pushing a lot of energy up here, right into my arm.
What do you experience? Because that, I haven't experienced of yet.
Oh, okay. I feel like I got to shake my arm to get it. It's coming into my arm. That's all I can say.
Sorry about that.
That's all right. I'm a glorified sewage worker. You know that. Fucking took on the job. It's like.
I think human sparking, human electrician is a really good way of explaining what we do.
Mm-hmm.
Because you could
But
say, like when the tension was
you get
it's
some
like
crappy
short
electrical
circuiting.
energy, I suppose you could call it.
Yeah, but you could say you're basically short circuiting, and that's why it makes sense in the page.
Do you feel that? Do you ever feel that?
Well, that's what you could explain the tension as, and that you're coming here to release it because that's what you just you're earthing it.
It's definitely working like with a similar thing to electricity, but it's a human life force.
The energy, yeah.
And then there's, to me, there's the natural and pure human life force which radiates out from the person, and then there's some sort of crappy, shitty stuff that blocks it and holds it, you know? And that's what we're trying to get rid of, so that the natural life force can just flow. And partly, partly it not being obstructed, but then partly whatever it is that's holding it, we get rid of. And that's why people say I feel lighter, like I feel like a burden's off me after a good massage, you know?
People walk out like marshmallows.
Yeah, that's right. And that's how because they're actually back in tune with their natural flow and whatever we can call this stuff that's sitting on them. And it could be different things for different people, because sometimes it's emotional, you know, whatever. It's all crap as far as I'm concerned, right? Shit, it's not what's good for the person. It stifles the person. It's gone and you feel better, okay? So that's when I say I'm picking up energy, it's the bad energy, right? Whereas we're opening up his good energy for himself, and that's why we have a good shower afterward, you know? But hopefully, you know, a lot of it just goes out of his breath, you know? Whatever it is that's bad.
When you say about the natural flow, that's when your body's at ease, right?
Yeah,
When it's stuck, it's not ease anymore.
that's right.
So it's dis-ease.
Yeah, that's right.
Dis-ease.
Yeah, disease, yeah. So when we look at, the origin of early English words, like, you
Well,
know,
that's what I think.
yeah, disease.
We have a similar thing in French.
Oh, yeah?
Maladie.
No, and mal means,
It's not like the worst of saying it.
right.
Divorced.
What was the last bit you said?
Divorce.
So, yeah, it's interesting. It's interesting. It's interesting to look at different cultural perspectives of what is health. You know, going from certain of the Western ones, which tends to be quite superficial and not accepting you know, even though they can't really explain the difference between a living body and a dead body. They just go, well, it's no longer alive and it no longer has the signs of life, you know? But, well, what is life? You know?
Well, when people think of holistic, I guess the point that it's holistic.
Yeah.
Not H-O is W-H-O. It should be,
Yeah.
because it's the whole thing. It's
Yeah.
mind, body, spirit.
That's right.
Everything's connected.
That's right, exactly. So I got a nice click out of that joint that wasn't going before, so I'm making some progress.
Is it moving?
That's the range of motion now I'm getting out of that joint. I'm still not quite happy with it, okay? But it's a lot better than it was, right? Yeah. So now, but I know that that's pushing him toward a 10, so I'm easing that off a little bit. You can see the redness go into his face. You can see how important this finger is in all, especially that side of his head. So I'm gonna let him breathe without doing anything.
Are you holding tension? Are you holding?
Not with any significant pressure. Just to bring awareness. So that I'm kind of going, because I know this is going to be, it's like,
Letting it process.
yeah, letting him process, letting him be aware that, hey, we're tight here, we're going to be working on a sensitive spot. And I'm going to go in slower and not quite as deep this time on that same spot, because I know how sensitive it is. So we want to get that point where he can just breathe it in. Because he's so tight in there. And again, I'm picking up a lot of that as it moves. And again, just let him breathe into that.
I think I need to go to people's care, which I found really hard because I obviously can't do it. I'm just doing very gentle touch therapy on them. But essentially, I've learned so much about the aging process, and a lot of them are just really contorted.
I always think there's two things going on. There's the aging process, and then there's aging of tension.
Yeah.
And you know, one is,
Don't use it, use it.
well, yeah, but it's like arthritis. It's like whenever I work on elderly people that haven't had massage before, these joints become completely stiff. It's so stiff, it's not funny. And you can hardly work on their fingers.
Yeah, like this.
That's right.
Yeah.
So much better to get this out when a person's young or middle-aged than to leave it into their 80s. And here I can feel this clicking now. It's starting to open up a bit, but it's still in a very clicky stage. So I'm going to come back in with the chopstick and let him breathe into that. So I'm paying attention to him and where he's at with it all. And again, as it eases off, I can go in a bit deeper, but I still feel that that spot's highly charged. And I think Dave would agree. That's Scottish for, I agree with you, Brandon. It is charged. Yeah. Yeah. That's what I learned when I was in Scotland. When they agree with you, they move their feet like that. I do try and combine a little bit of laughter therapy. You know, sometimes people have to laugh at themselves because they're in pain and laugh and cry.
He's got very expressive feet, this Dave.
Yeah.
He's walking right now.
Yeah. He's actually walking out though.
He's paddling in the Thames.
Yeah. Yeah. And he's so tight in here.
Laughter's the best fun.
Oh yeah.
Unless you're diabetic, then insulin's quite
Or just not having too much sugar. So you can see, it's interesting how many people are tight on this finger.
And it's just like you just.
Oh yeah, I'm not.
Finger, like when his reaction.
Oh yeah. You can see, okay, this is me just holding the chopstick in place. And this is me just going in a small amount of pressure. And that's the pressure I'm using so that it's not. But it's because he's tight.
Yeah, when I first tried, I made myself really jump on myself. When I
Yeah.
first went in, I was like, oh my god.
Yeah, be more gentle with yourself.
And then the hard way.
Yeah. Okay, so then I'm going to try and just, you can see this corner as this band comes around is just so charged. And as I said, this finger, it's actually quite common on a lot of people to be discharged. So I'm just trying to get in there now a little bit and connect from here to here. And this is why I say I spend a lot of time in this area. And then I can come in here and again just. So we can